Welcome back. Next, we're going to go through all of the anatomy of the sacral center. So turn to the pages in your manual as designated on your assignment sheet. We're going to review the male and female reproductive systems. Now, please note that I'm referring to this system as the female reproductive system, but with the utmost understanding and respect for people who may identify as male while having this system. As we work with our clients, we need to be aware of this and ask or include it on our history form which body parts are present and how our client prefers to be referenced as he, she, or they. And we'll talk about this a little more in the practical portion of our class. But I will be using the terms female reproductive system and male reproductive system. So first we're going to look at the female system. The endocrine glands are the ovaries. We have two ovaries. The ovaries produce the hormones estrogen and progesterone. The ovaries hold egg cells that mature into an egg, and then a mature egg is released during the monthly cycle. Did you know that a baby is actually born with all of the eggs that the ovaries will ever produce? I thought that was interesting. I didn't know that. In the system, there are fallopian tubes. Here's the fallopian tube. And they extend from the uterus to the ovaries. And they have finger-like little projections that hover close to the ovary, and they kind of tell the egg, come to me, come to me. During that monthly cycle, we ovulate and an egg is released from the ovary. The fallopian tube fingers grab it, and then the little hairs called cilia gently carry the egg along the fallopian tube into the uterus. If there's a sperm waiting in the uterus to meet and greet the little egg, then ta-da, a baby is formed. If there's not a sperm waiting, then the lining of the uterus is shed and we have a period. Yippee! The uterus is shaped like kind of like an upside down pear. It's a thick, muscular, hollow organ in the pelvic area. It sits between the bladder and the rectum, which I'll show you in another picture. During pregnancy, the uterus holds and supports the developing baby. The opening of the uterus is the cervix. It's the lower part of the uterus. It's made up of strong muscles. The function of the cervix is to allow flow of the menstrual blood from the uterus into the vagina and to direct sperm into the uterus. It is the cervix that dilates during childbirth, allowing the baby to move out of the uterus. I added this slide just so you could see the position of the uterus and the other structures from the side, where they're located, front to back. So in the front, we have the urethra and the bladder, and then we have the vagina and the uterus with the baby, and then in the back we have the bowel, the rectum and the bowels. So that's the arrangement, and it's nice when things stay where they're supposed to stay, but a lot of people develop issues with these structures not staying where they're supposed to. Our bladder can fall. So here's normal up here. This is the urethra and the bladder. And then this is what's called a cystocele. So we have the urethra, and see how the bladder has fallen down? And then we can have a condition where the uterus falls. That's a uterine prolapse. You've probably heard that word. So that's where the uterus falls down into the vagina. And then I don't have a picture on the screen here, but you can have a rectocele, where the rectum collapses. And so any of those can happen. And I've had some success using esoteric healing to lift these structures and actually prevent surgery. To be honest, the first client I tried it with, I did not think it would help because she could actually feel the uterus falling out of her externally. But honestly, after one session, she actually felt quite a lot of relief. And I just hit on it. Every time I see her once a month. Every month, I do a little lift, and she's never needed surgery. So it kind of stays. It'll kind of fluctuate, but the esoteric healing has really helped her. Next, let's look at the general male reproductive system, which is oriented around the bladder. Again, we remain respectful to those who may have the system but may not identify as male. And also respectful for those who have had surgeries and the anatomy may not be just as it's presented here. So, what is the endocrine gland of this system? It is the testes, 2 testes. They are about the size of large olives. The testes produce testosterone, which controls sperm production, and they make millions of sperm cells when puberty begins. The spermatic cord then, here, is a cord that's made up of the vas deferens, blood vessels, and nerves of the testes. The vas deferens is where a vasectomy can be done for sterilization. So they would cut or tie this. I'll show you in a picture in a bit. Let's see. The seminal vesicles here are above the prostate and provide an alkaline-based, like a nourishing type of fluid that gives sperm the energy to swim when they are expelled. So sperm travel from the testes through the spermatic cord and into the seminal vesicles to collect energy, fluid, and are then ejected out into the urethra. So here we have the bladder and the urethra. So they're ejected into the urethra and then ejected out the urethra. The prostate gland is a walnut-sized gland at the base of the bladder and surrounds the urethra. So right here is the prostate gland. It provides an acidic-based milky white fluid that nourishes and protects the sperm. As age advances, the prostate gland may enlarge, sometimes to the point that it might begin to block the flow of urine. If we assess this, we would sense that the prostate was large, and we can also sense that the urethra might have like an hourglass shape through here, more narrowed in the area of the prostate, where it's kind of pinching on the urethra here. Here's a picture in the body so you can get a better idea. Here we have the testes and the spermatic cord. We have the seminal vesicles here and enter into the urethra and out the urethra. Now here's the bladder with the prostate gland below the bladder, and you can see how it could, if this was enlarged, how it could impinge or kind of squeeze on the urethra. And then there would be difficulties with urinating. So definitely something to get checked out by a doctor. On this slide, you can see pictures of tubal ligations and vasectomies. In tubal ligation, the fallopian tubes are cut or tied. So they go in through the belly button, then they either cut the fallopian tube or tie it, depending on the surgeon. There's different techniques. So this shows it being more cut and tied or banded. And then here's a vasectomy. In a vasectomy, the vas deferens is cut there. So if you are working with somebody and you feel a tubal ligation or a vasectomy, you can ask your client if they've had, what procedures they've had done, or you can just skip over this area, depending on what you're working on. I always like to just include it in my form, like specifically on my form as a question, because even though I take a surgical history, people do not think of these procedures, tubes tied or vasectomies, as a surgical procedure, so they don't remember and they don't put it on their form. So I ask it as a specific question, and then if I sense that as I'm scanning through that system, then I can just peek back at the form. I don't have to bring it up. Now, if I sense a restriction and they're coming to me because they are trying to get pregnant, then of course I'm going to work that area. So we just have to know kind of what we're working on, and what procedures they've had done in the past. So this concludes the anatomy video of the sacral center. So for your homework, I'd like you to review all of the sacral center triangles that you learned in part 1, and including sweeping through or scanning through the systems, both male and female, if possible, practicing on friends, family, or on yourself. So that is your homework, and I will see you in the next video.